All right, let's get right into it. Today, we're unpacking a story that's pretty wild. You've got this incredible mix of cutting-edge tech, just massive scale, and a really human-focused mission. It's all about a hospital network that isn't just treating patients. They're trying to completely rewire the DNA of healthcare itself.
So let me ask you something. Just picture this. You're at the hospital, you're waiting for some really important test results, and you're just anxious, right? Now, what if that wait time could be completely crushed? I'm not talking about shaving off a few minutes. I mean, what if it was 8 times faster, all because of AI?
Well, this isn't some far-off sci-fi dream from Silicon Valley. No way, this is actually happening. Right now, at a place called Narayana Health. It's a huge hospital network in India, and honestly, they're pioneering a totally radical new way of looking at medicine.
And look, to really get how they're pulling all this off, you've got to understand the why behind it all. It really boils down to the founder's vision, a dream that's, both super simple and at the same time just incredibly ambitious.
This quote here from the chairman, Dr. Devi Shetty, it's just so powerful. Because, it's not just some corporate mission statement they hang on a wall. It feels like a real moral commitment. It's this core idea that top-tier healthcare shouldn't be about how much money you have or where you live. And that single idea, it's like the engine driving everything they do. It's their North Star. It shapes their strategy, their day-to-day operations, and, as we're about to see, why they've gone all in on technology. Because, hey, it's one thing to have a dream, right? It's a whole other thing to actually build the system that makes it real.
Okay, so how does a big vision like that actually work in the real world? Well, this is where things start to feel like they're straight out of the future. Narayana Health is using AI, but not as some flashy gimmick. For them, it is a core, fundamental tool to actually deliver on that promise they made from day one.
And check this out for a perfect example of the impact. The old way? You could be waiting 4 to 6 hours for a blood test report. With their AI-powered lab system, they've got that down to under 45 minutes. I mean, just stop and think about what that means in an emergency room, when every single minute counts. It's a complete game changer for patient care.
Okay, get ready for this next number. When I saw it, I literally had to read it twice. 80%. What on earth in a hospital could you make 80% more efficient? Any guesses?
The answer, it's the paperwork, all that documentation. They've rolled out this incredible AI voice tool that just lets doctors dictate their notes. And that one changed documentation time by a staggering 80%. This frees up doctors to do what they're actually supposed to be doing, talking to patients, not typing into a computer.
And it's not just that one thing. The AI is woven into everything. They have machine learning that can predict cardiac problems from an ECG with 97% accuracy. They've got bots handling all the tedious medical coding and insurance claims. They even have a no-code platform that's automated over 100 different systems. They are just systematically hunting down and eliminating inefficiency everywhere.
Okay, so the big question here is, that's all great, but does all this fancy tech and efficiency actually lead to better care when you're dealing with millions of patients? Well, let's take a look at the numbers.
Let's start with the labs. In just 1 year, they ran over 26 million lab tests. Just try to wrap your head around that number for a second. The level of precision and control you need to manage that is just off the charts.
Then, on top of that, you have the actual patient visits. They handled more than 2.5 million outpatient consultations. Can you even imagine the logistics behind making sure every single one of those journeys is smooth and safe, day after day?
And then you've got the treatment side. For some of their most vulnerable patients, they administered over 82,000 rounds of chemotherapy. So when you add all that up, the sheer scale of what they're doing is it's immense.
But here's the really mind-blowing part. All that volume, all that scale, it doesn't mean they sacrifice quality. Not at all. Get this, their medication error rate is, it's just astonishingly low. It's about 0.74 errors for every 1.6 million times they give out medicine. That's a rate of less than 0.00005%. That's where you really see how obsessed they are with safety.
Or take something like patient falls. It's a pretty standard way to measure hospital safety. The industry benchmark is about 1 fall for every 1,000 days a patient is in the hospital. Narayana Health's number? It's just 0.12. That is more than 8 times better. It's just another clear sign that they're creating a much, much safer environment.
And all of this comes from a central idea they live by, something they call zero-harm healthcare. And it's exactly what it sounds like.
It's this total obsession with their processes, with monitoring everything, all with one single goal. Use every tool they have, technology and otherwise, to get rid of all preventable harm to their patients. Period.
But the story doesn't stop there, not even close. It's not just about the clinical results. Remember that original mission we talked about? Well, it reaches way, way beyond the hospital walls.
See, they're also deeply invested in social responsibility. They're actually going out and tackling the root causes of bad health, by focusing on things like community programs, education, and just helping people with their basic needs.
Just look at their Udana scholarship program. I mean, this is just brilliant. It's a perfect full circle idea. They find these really promising students from rural, disadvantaged backgrounds. They pay for all their medical school coaching and their education. And what happens? They create a whole new generation of doctors who are then way more likely to go back and work in those same underserved communities. It's genius.
And the list just goes on. They run feeding programs for thousands of kids. They're making sure thousands more have safe drinking water and sanitation at school. They even run free testing camps to help children with blood disorders find a life-saving donor. This isn't just charity on the side. This is compassion baked right into their business model.
So, when you step back and look at the whole picture, the incredible tech, the world-class quality, the massive scale, and this deep social mission, you just have to ask yourself, what does this mean for the future of healthcare?
What we've really seen here is a model that's built on three incredibly powerful pillars, right? You've got extreme efficiency, all powered by AI and automation. You've got world-class quality, even at an insane scale. And holding it all together is this core mission of social responsibility.
And that really leaves us with one big question to think about. Narayana Health has proven that you can combine the cold, hard efficiency of technology with the deep warmth of human compassion. So the question is this just a one-of-a-kind success story? Or are we actually looking at the blueprint for the future of healthcare for everyone?